Hello, everybody. September being PCOS month, we are exploring some questions that we often get in our practice. I am Rashmi Gopal. I'm an integrative nutrition health coach. And we have Dr. Anupama here. She's an Ayurvedic fertility specialist from Shrestha Ayurveda. Hello, Doctor.
Hi, Rashmi.
Doctor, you were mentioning the last time that there is obese PCOS and also lean PCOS. There are two kinds of PCOS. So, how does Ayurveda approach difference between obese PCOS and lean PCOS cases?
Yeah, that's a very important question because for many years people are not even aware that even people who are not overweight, women who are not overweight also can have PCOS. They were not even suspected and the
Mm.
treatment was not even started because since you're lean, you cannot have PCOS. Thankfully, there is more awareness that 20 to 30% of the overall PCOS patients can have lean PCOS where there is no weight gain. They can be lean to moderate weight, but they are classified under lean PCOS. And in Ayurveda, just like anything else, we do start by looking at the person, at the rogi, at the patient specifically, and their unique combinations of challenges in their PCOS. And most often, when we start with the treatment, we also look at their changes in the doshas or the imbalance of doshas. And most often, in overweight or obese PCOS, we see more of the kapha imbalance, and most often in the lean PCOS, we see vata and pitta imbalance more than the kapha imbalance. That itself will start us on the right line of treatment. And also in lean PCOS, we do see changes. In the stress sensitive hormones, there is more inflammation and more, hormones from the brain or the among the HPO axis in the hypothalamus and the pituitary hormones, we do see more imbalance and more mental health challenges. Based on that, very specifically, the herbs, the panchakarma, the diet, and the lifestyle all are chosen based on that. So we deal with lean PCOS and obese PCOS almost completely differently. And even when it comes to fertility treatment, the treatment protocols have to be very, very different and very unique to the individual while seeing the difference between the lean PCOS and the obese PCOS. And also while doing the fertility treatments, lean PCOS, people are told that their PCOS is very mild, so they don't have to do anything, and straight they jump to the fertility treatment, which usually fails the whole the purpose of the treatment itself. So it becomes very important to do that, and and I'm sure you see a lot of lean PCOS patients also. Now that there is so much awareness, they are approaching you, and many of them do not realize that diet plays a very important role in the management of lean PCOS as well. Tell us something about that.
Correct, doctor. Lean PCOS women, they think that diet is not very important because they don't have an overweight issue. Obese PCOS, it's quite obvious that they start with weight management. When it comes to lean PCOS, there is always this misunderstanding. But lean PCOS women can have insulin resistance quite often, though they don't have a overweight issue. So we will have to work on stabilizing their blood sugars. So diet plays a very crucial role there. And also they almost always have inflammation, and also as you mentioned, their stress sensitive hormones are always imbalanced. So we need the diet and lifestyle has to be balanced to manage that. So it's very, very crucial to nourish them because they're also nutritionally deficient in many cases. So diet is the first step, and their stress management, their sleep, uh, all the lifestyle parameters have to be looked into. Very, very important.
Yeah. Sometimes in my clinical practice, I see that, obese PCOS patients, of course, find it very hard to lose weight, but with the right kind of guidance, when they start losing weight, we see the
Mm.
hormone shifting quickly. Even when they lose not 10 kgs, just 10% of their weight, we see that the hormones moving in the right direction. The same way when it comes to lean PCOS, it is harder to manage the condition because there's nothing to lose. There's only nourishment which is needed. So I hope all PCOS women there who have lean PCOS, understand the importance of, very unique personalized treatment and also importance of diet and lifestyle to manage their lean PCOS.
Absolutely.
Yeah.
We see sometimes, their menstruation gets regularized. We see many cases where their gut health improves and a lot of these patterns improve, their mental health improves. So these are few very subtle parameters that we can observe in these lean PCOS women. But it's very important to take care of it.
Absolutely. Yes. Okay, let's keep the questions coming and we'll address them soon. Yeah. Okay, Rashmi.
Okay, doctor. Thank you.